Promising news as we approach the end of a year with COVID-19 raging all across the country. In clinical trials of the Moderna vaccine, it was 100% effective in preventing severe cases of COVID, and about 95% of the people who received it didn't get sick. KFDM's Paige Hubbard reports on what could be a breakthrough in the battle against coronavirus.
The company in charge of distributing the Moderna COVID-19 vaccine has filed for an emergency use authorization. This comes after 30,000 Americans participated in trials for the vaccination. 15,000 patients received the vaccine, while the other half were placed in the placebo group.
Only 11 got the virus and it wasn't severe. It's very promising, so it gives us hope for hopefully the next coming year to all this subside and we go back to the pre-COVID times.
Dr. Chinwendu Amushi is a clinical pharmacy specialist at Baptist Hospital and will be in charge of distributing and vaccinating healthcare workers with the COVID vaccine. She says the Moderna vaccine is similar to the Pfizer vaccine, and the size of the two company studies wound up being comparable.
I was kind of skeptical at first with the Pfizer because it was a small population size, but now we're seeing it in a wider population, so 30,000 U.S. citizens. So that is like a good sample size.
The vaccine has been proven to be effective across all age groups, ethnicities, and genders. Nearly 7,000 participants were over 65, and another 5,000 were under 65 with underlying health conditions that put them at higher risk. Doctors say that's another impressive fact about the vaccine.
Well, I feel like with this vaccine, or the COVID vaccine in general, is definitely very promising, and we should definitely consider getting the vaccine, especially since it can decrease our numbers, especially with the surge that we're having right now, and it can definitely help us in the future of getting through this hump with the COVID cases.
If Moderna's emergency use application is approved, the vaccine could be rolled out as soon as December 21st. From there, it will be up to the CDC to decide which American population will get the vaccine and in what order.
So Texas is qualified to get the vaccine. With phase 1, it will only be available to healthcare workers and essential workers until they have more vaccines available. And then as that rolls out, they'll go into phase 2. Phase 3 will be available to the public.
In Beaumont, Paige Hubbard, KFDM 6 News.
And we've heard this time and time again, but the pharmacist again reminding us right now it's not time to let our guards down. Facial covering, social distancing, and other guidelines will remain in effect even after the vaccine is put to use.